the second hour of June 24th show, Monday, June 24th, 2013. I am your host, Dr. Peter Glidden. If this is your first time tuning in, welcome aboard. I am a licensed naturopathic physician. I have over 24 years of clinical experience in the delivery of science-based, clinically verified therapeutics, which are alternative to drugs and surgery. It may interest you to know that naturopathic physicians in states in which they are licensed and regulated can perform minor surgery, can deliver babies, can order any diagnostic test they want, can legally refer to themselves as physicians. Well, not in every state. Not in every state. For goodness sake, in Illinois, where we're not licensed or regulated, you can't even use the term doctor to describe what you do, even though I have been educated and matriculated at a fully accredited doctoral degree granting medical university in the United States. The great state of Illinois says that only people with an MD after their name can call themselves doctor. And if that isn't the biggest crock of crap you've ever heard, I don't know what is. Avoid Illinois like the plague if you're thinking about practicing naturopathic medicine. The taxes stink here as well. Quite frankly, my advice, until the Illinois Department of Professional Regulation does right by me, stay away from Illinois. It's a horrible place to do business. But I digress. I bring to the table decades of experience with the delivery of therapeutics that your medical doctor is completely clueless about. Completely clueless about. That's what we talk about all day long here. And when we're not talking about it live, you have access to the podcasts 24/7 at drglidden.com or fireyourmdnow.com. Check out my book of the same name, The MD Emperor Has No Clothes. The MD Emperor Has No Clothes. I've got CDs, I've got DVDs, I have online health recovery programs, and tonight, if you're a subscriber, it's my introduction to longevity at 8 o'clock Central Time. Looking forward to that. There's always a big crowd in the Monday night webinars, and we always do a lot of good. We're going to try to do some good right now in Florida, talking to Carol about something to do with teeth. Hey, Carol, thanks for the phone call. You are live.
Hi, Dr. Glidden. Thank you for taking my call.
Yeah, thanks for waiting so long. How can I help?
Well, I presented this to you this morning in the chat room, but my sister has loose teeth, and I failed to mention that she's got periodontitis, and she's taking propolis astragalus, and she wanted to, her tooth is really loose, and she wanted me to ask you what you thought about hydrogen peroxide as a cure for, until she gets, I ordered all those things you told me to get for her.
Okay, well, we have to dial in specifics here, right? So the problem with periodontal disease, receding gums and loose teeth, is not a lack of flossing, as your dentist would have you believe. It's not a plaque buildup, as your dentist would have you believe. It's chronic facultative breakdown of gum and teeth nutrients. It's your teeth and your gums are running out of the nutrients they need to maintain their structural integrity. You know, there's over 278, I believe, over 278 diseases caused by not enough calcium. Holy smokes, that's a lot. Just, you know, from one deficiency in one nutrient, calcium. There's 89 other nutrients, remember. But it's a fascinating thing because, you know, you could have quintuplets, ostensibly. You could have quintuplets, all with exactly the same genetic makeup. They eat the same food. They live in the same house. They're subject to the same environmental stress, right, more or less. Each one of them could have a calcium deficiency, and they would have 5 completely different sets of symptoms. Now, nobody knows why a calcium deficiency in one person gives funky teeth, and then another person gives a funky left knee joint, and then another person gives high blood pressure, and then another person gives a funky right elbow joint. Nobody knows why these things gravitate to the part of the body that they gravitate to, and that's a fascinating field of study right there. I don't even know what you're going to call that. Glidden pathophysiology. That's a good name, I think. But my point is that it's a calcium deficiency. You might not think, holy smokes, I thought calcium deficiencies, you know, gave me arthritic knees. Well, sometimes they do, but they also give this problem. So one of the immediate solutions for this would be once she gets the white liquid calcium, I would have her, put an ounce of the white liquid calcium with a little bit of water into her mouth and just swish it around in her mouth for, 60 seconds. Swish it around in her mouth for 60 seconds before she swallows it. It would also help to get a bottle of the plant-derived minerals all by itself, not the cherry mints, just the plant-derived minerals, and follow the calcium swish with a mineral swish. And if she does those back-to-back, calcium swish, swallow, mineral swish, swallow, she'll really go a long way towards supporting and promoting the structure and function of both the gums and the teeth. Now, into the bargain, in the meantime, the only thing that hydrogen peroxide is going to do is prevent an infection from forming, because that's what hydrogen peroxide does. So I don't really think there's the probability of an infection forming just because the tooth is loose. I don't care what the MD has told her or what the dentist has told her. Really, she needs to, get the calcium, the liquid calcium specifically for this condition, into her body as rapidly as possible. Now, is this the woman that just had chemotherapy? Is that who we're talking about?
No, that's a friend. I have so many friends.
Yeah. Okay, yeah, so this will do it. The teeth will tighten, the gums will tighten right up around the tooth. I mean, they'll tighten right up around the tooth. I had a nice testimonial a couple of weeks ago on the live chat session about a person who called into the radio show, I think a month ago, with painful teeth. They had really sensitive and painful teeth. And I told them to do that program that I just described to you, and they reported on the webinar that the teeth pain was completely gone. Well, the gum condition will go away as well, because, the gum and the tooth, there's an intimate relationship there. And if either one of them are nutritionally deficient, then there's going to be a breakdown. And the biggest problem here, however, Carol, the biggest problem here is that simple stuff like this, this is elementary, right? This is simple stuff. Her dentist doesn't know this. Her medical doctor doesn't know this. Her periodontist doesn't know this. Her dental surgeon doesn't know this. And more's the pity. That's why I do this radio show. That's why we have the webinars. That's why we have the online health recovery stuff. That's why Dr. Wallach, at 74 years of age, gives 300 free lectures a year. Can you imagine that? 74, 300 free lectures? The guy lives on American Airlines, for goodness sake. So, we're on a mission. Let's make no doubt about it. Let's have no bones about it, because everybody's sick and suffering needlessly. And honestly, the reason why we succeed and the reason why we persist in such an oppressive political and legal climate, this great state of Illinois doesn't even let me call myself doctor, let alone practice, let alone make a diagnosis in the state of Illinois. Can't do it here. Can't do it here. Can't do it in 36 other states in the United States. That's nuts. That's an oppressive legal system that my profession is up against. And even though we're up against it like that, we succeed, and the business grows every year. We get more patients, we get more business, we get more patients, more business, because it works. So she's going to love how she feels, even after just 7 days on this program. Now, God bless you, Carol, for dragging her into the light of medical nutrition. Don't you worry. This stuff is as true as the North Star, as true as the Pole Star. The only time that medical nutrition fails is if you're not taking enough or you're eating stuff that's gumming up the works. If you had a little tomato plant that you'd forgotten all about, and you finally pulled it out of the dark and potted it with good soil and good fertilizer and good water and good sunlight, chances are it would bounce back and you'd get good tomatoes. Well, guess what? If a little scraggly tomato plant can bounce back, you think the human body can? The answer is unequivocally yes. So go out there and get them now, Carol. And I want you to tell 10 people a week about what you're up to. 10 people a week, and that's how we're going to change the world. Thanks so much for everything that you do. Any more questions?
Nope, I'm on the crusade with you.
All right, you go, girl. We need the help. Keep up the good work. All right, folks, here we going next. It looks like we are going, pretty close to Florida. Going to go to Alabama and speak to Bill. Hey, Bill, thanks for the phone call. You are live.
Hi, Dr. Glidden.
What's going on, Bill?
Well, I've got two very good friends who desperately need your help.
Okay, well, I'm just the man for the job, I hope.
I know you are. They're going to know it after today. Patient number one, She smoked until about 5 years ago. The lady is around 60 years old.
Yeah.
And she quit smoking, but now her lungs are already damaged. The doctor diagnosed her with something called COPD, and she can't walk over 100 feet without having to stop and sit down and rest, out of breath.
That's the son of a gun, isn't it?
No,
now,
boy, she's miserable.
Yeah. Was she having the same problem with walking while she was smoking, or was she okay?
I'll tell you the truth, I really don't know about that. I think this is something that's come on. Well, let me tell you, about a year ago, she had a real bad cancer scare. The doctors thought she had lung cancer.
Yeah.
But they checked her out, and she got a clean bill of health on that.
Yeah. Okay.
But her breath is shorter every day. I can tell myself within the past couple of years she's really gone downhill.
Well, thank God for small favors, right? At least it's not cancer. So what we do then? Now, listen, man, I got to tell you the truth. There is a breaking point. There is a point beyond which the body can't fix itself. And, I used to think I knew what that was before I met Dr. Wallach. But I got to tell you, since I've been following Wallach's advice and using his products and leaning on his research, are you kidding me, man? I have no idea where the physiological breaking point is. There is one, and maybe this woman's already past it, but you never know. She needs the 90 essential nutrients for the rest of her body anyway, so there's nothing to lose into the bargain here. Stick with me, Alabama. We're up against a hard break. When we come back, I'll dial in the program for her and for the other person. Why? Because that's what we do, you and I together and everybody else in Longevity on Team Glidden. We are going to change the world. Stick around, folks. I'm Dr. Peter Glidden, and we're hunting for bear today. Yeah, you'd be hot-blooded, too, if you sat behind my desk for 24 years. For goodness sake, you wouldn't believe the massive amount of incompetence, misdiagnosis, and just plain dangerous, old-fashioned, stupid therapeutics that my patients over the course of 2 decades have brought to my attention. And that's just standard operating procedure medical care. It is unbelievable, ladies and gentlemen, the amount of incompetence that MDs can produce and still have jobs. Let's go right back to Alabama now and finish up with Bill. So, all right, Bill, check it out, man. Is budget an issue here for this woman or not?
I don't believe so, no.
All right. So that's a good thing, man, because she needs help, right? I mean, this is like emergency treatment big time, right? So we're going to overdo it here. Not too much, just enough. So the recommendation to support and promote the structure and function of her respiratory tract system would be, number one, of course, complete elimination of the 10 bad foods. You just have to stop eating that crap, 100%. I don't even want her to look at those foods, right? Number one. Number two, she needs one anti-aging healthy start pack per 100 pounds of body weight per month. One anti-aging healthy start pack per 100 pounds of body weight per month. I want her to take 4 bottles of selenium a month, regardless of how much she weighs. 4 bottles of selenium per month. 2 bottles of the EFA Plus. 2 extra bottles, because there's EFA Plus in the anti-aging healthy starts. But I want her to take 2 extra EFA Plus per month. And then to top it off, the secret sauce, 4 bottles of Z Radical a month. That's 1 bottle a week. 4 bottles of Z Radical a month. That's 1 bottle a week. So there's 32 ounces in a bottle. 32 divided by 7, that's what, 4.5 ounces a day. I wanted to do 4 to 5 ounces of the Z Radical a day, all right? So we have her do the Z Radical, the selenium, the extra EFA Plus, and the anti-aging healthy start pack, appropriate for body weight, and eliminate the 10 bad foods. Now, generally speaking, when people do that program and they have chronic obstructive pulmonary disease, whatever the causative factor, within 4 weeks, there's a noticeable, measurable positive improvement. If 4 weeks goes by, man, and nothing has happened, she's not taking it correctly, she's not following directions, she's still eating the 10 bad foods or something, So you're going to have to pay attention to this and make sure that she sees improvement. If she sees improvement, then life is good, and it's just a matter of time until her lungs optimize their function to the degree that they're able to bounce back. All right, number 2, William, who's up next?
Ask you one question about this. You said the Healthy Start Pack, the anti-aging, is that the same thing as just a regular Healthy Start Pack?
Yeah, good question. No, it's separate and distinct. It's the Healthy Start Pack plus an extra bottle of something called Cell Shield RTQ. And if you buy the Cell Shield RTQ already bundled into a Healthy Start Pack, you save money.
Okay, so that's the anti-aging that has the extra thing in it, right?
Yeah, that's right. Anti-aging Healthy Start Packs. Just look that up in the back office. It's one of my favorite Healthy Start Packs, but for some reason that nobody else pushes it as much as I do. I guess that's because nobody's as smart as I am. What the heck? All right, Bill, who's next?
Music, I'll give you that. Yeah, well, I know the rest of these items you're talking about. I had a question about that one. All right, patient number 2.
Yeah.
This lady had thinning bones a few years ago, rheumatoid arthritis and thinning bones. Well, this might be another case of the incompetent doctors, but they started her on something called Fosamax.
Yeah.
And it did the job. I mean, now she's got... her bones are okay. They filled out again.
Well, they're not,
left her with acid reflux. She blames that on the Fosamax.
Yeah, well, that's correct. She's a smart girl. But look, the way that Fosamax works, and Boniva, there's a system in your body that your body is regenerating bone tissue all of the time. It's chewing up old bone and laying down new bone. Fosamax puts the cells that chew up old bone to sleep. So what happens is old bone accumulates in the bone, which makes the bone density look better, but now your bones are filled with old bone, and what the heck was the body trying to do with the old bone in the first place? Get the heck rid of it. So now her bones are filled with old bone. They're not as thin, quote unquote, as they were before, but now they're filled with old bone. And what's going to happen 4 years from now is she's going to step off of the curb and her leg's going to snap in two like dry tinder. And there's a new round of class action lawsuits against the makers of Fosamax and Boniva for this condition called spontaneous leg fracture, because Fosamax for thinning bones is like painting over the mold in the basement. It is a temporary fix, and it has trouble. Stick with me, Bill. I'll be back after these messages. If you're listening to the podcast and want information about the health opportunity or the wealth opportunity, for goodness sake, if you're listening to the live broadcast and you want the same info, that number, 855-347-3696. That's 855-347-3696. Guess what, ladies and gentlemen? You're not going to believe it. Has the Earth stopped turning on its axis? I don't know what it is, but I just got a little text that my son in Seattle is listening live. Let's give him a good old-fashioned round of applause, shall we, from Dr. Glidden. Let's check it out. Come on, there we go. Let's try that one more time. Hey, I dialed it in. Love you lots, buddy. Very proud of what you do. Keep up the good work out there in Seattle. Good to have you in the listening audience. Let's go back to Alabama and talk to Bill. All right, Bill, so here's the deal, man. Just do a Google search, all right, for Fosamax. That's F like Frank, O, S like Sam, A, M-A-X, Fosamax lawsuits. You'll be horrified, because Fosamax doesn't fix the problem. It only masks it over. It looks like the bones are more dense, and, they're filled with old bone. But after they've been filled with old bone for 3, 4, 5 years, they start to snap like dry tinder. And that's the latest round of class action lawsuits against Fosamax. It doesn't work. It doesn't work. It doesn't work. And it should be outlawed, quite frankly. So what we do, on the other hand, in order to support and promote the structure and function of the bones, is we provide the body the raw materials it needs to have healthy bones. And, that's not rocket science. That's just good, new-fashioned medical nutrition. So, interestingly enough, what are the bones made out of? Well, calcium and minerals, right? And a bunch of sulfur-bearing molecules, chondroitin sulfate, glucosamine sulfate. And what does the body need to have healthy stomach acid? It needs calcium. So the reason that this woman is having heartburn is because her calcium deficiencies have caught up with her, and they've been accelerated probably by the introduction of the Fosamax into her diet. So we're going to kill two birds with one stone here. We're actually going to support and promote in real time the structural integrity of her bones, and we're going to support and promote the structure and function of stomach acid. So the recommendation for her, Bill, is 1 healthy digestion pack. 1 healthy digestion pack per 100 pounds of body weight per month. 1 healthy digestion pack. 1 bottle of selenium per 50 pounds of body weight per month. 1 bottle of selenium per 50 pounds of body weight per month. 1 extra bottle of either the Osteo FX Plus or the Cal Toddy a month. 1 extra bottle of the liquid calcium a month. And to top it all off, glucogel. She needs 1 capsule of glucogel per 10 pounds of body weight per day, right? So if she's 120 pounds, she needs 12 glucogel a day. She'd do 4 with breakfast, 4 with lunch, 4 with dinner, and so forth and so on. So calculate how many bottles she needs based on the 1 capsule per 10 pounds per day. Plus, she's got to eliminate the 10 bad foods, and the secret sauce to help the heartburn go away, lickety-split, is salt her food liberally. Have her start using table salt liberally because her stomach needs salt to have strong stomach acid. She has reflux not because she has too much stomach acid, but because she doesn't have enough. The MD's got to completely ass backwards again, and if she continues to listen to their advice, they're going to kill her. This is a relatively easy thing to get on the other side of. Both of these things are relatively easy because what are we doing? We're supporting and promoting the body's own ability to fix itself, and within 4 weeks, she should experience a remarkable turn around. Thanks, Bill. I got to take the next call. I appreciate everything that you do. I think that advice was clear enough. I appreciate the phone call. Going from Alabama to California now to talk to Kevin. Hey, Kevin. Thanks for the phone call. You are live.
Hey, how you doing today?
Yeah, I'm pretty good. What's the latest, man? How's it going?
All right. Well, I had aortic valve surgery about 4 months ago due to, I guess they said I had rheumatic fever when I was a kid. And so I've been taking longevity and my basic meds, but I want to get off the statin, which is the Lipitor. And I need to find an essential fatty acid that's going to work without getting me dizzy, because I tried the fish oil, and I was just a walking zombie, and I was very lightheaded.
Okay, well, we're mixing metaphors here, right? And so there's a number of things that are going on here. How old are you, by the way?
I'm 43.
Okay, and when did you start having trouble with your heart?
Well, actually, I was walking up. I always had a slight heart murmur, but they said it wasn't a really big deal. Yeah. And I was walking upstairs one time and had an angina and passed out. Ended up having to go to the hospital after a couple of days of just thinking it wasn't a big deal, but it wouldn't go away. So they put me in and told me I had to get a aortic valve replacement. And
how long ago was that?
4 months ago.
And how old are you?
43.
All right. I'm sorry I asked that twice. So 43 years of age. Now, does it make sense to you that a rheumatic fever that you had as a kid would be able to damage your heart valve, 42 years later? Does that make sense to you?
No, not really.
Exactly correct. I mean, they say stuff and we just take it as gospel. I mean, if you won the lottery, bought a brand new Porsche, you're driving it down the road and you start to hear a funky sound in the engine, and you bring it to the Porsche dealer, and the Porsche dealer tells you that the reason that you're hearing a funky sound in the engine is because there's a bee in the trunk of the car. There's a bumblebee in the trunk of the car. You going to buy that? You wouldn't buy that. It's nonsense. But when a medical doctor tells you you had a problem with rheumatic fever 40 years ago and it took 40 years for that to cause a problem in the heart valve, it's like, oh, really? Right? We've drunk the Kool-Aid, brother. I mean, we've drunk it down hard. And I don't know why we do this culturally. And it's not just you. It used to be me. It's everybody, quite frankly. A medical doctor could tell somebody to jump off of the roof of the hospital in order to cure themselves from whatever, and they'd believe it and they'd do it. This is how much trust we've given these people. For goodness sake, it's Stockholm Syndrome. Stockholm Syndrome is when the kidnappers become, or the kidnappees develop feelings of affection for the people that kidnapped them. I mean, why we listen to these people and take everything that they say as gospel is beyond me. But the fact of the matter is you had a problem with your heart valve. Now, are you an exercise guy? Are you an athlete?
Oh, well, not really. I just, I'm on my feet. I work 2 jobs, 80 hours a week, and, I'm up and down, and, I walk 6-7 miles a day between the 2 jobs and lifting heavy boxes and going up and down stairs all day, so.
Oh, are you like a UPS guy or FedEx guy?
No, I work 2 jobs. I work 2 jobs, so.
Yeah, okay. All right, good. So, well, here's what happens. There's a condition called athlete's heart, and it was diagnosed in pre-World War II Germany. It's the heart muscle enlarges. Now, when the heart muscle enlarges, it enlarges because it's stressed. It's under stress. You're doing a lot of physical work, walking up and down stairs, carrying boxes, and it doesn't have enough nutrients in order to maintain the structural integrity. The main nutrient of concern here is the mineral selenium. Selenium causes cardiomyopathy, enlarged heart. So, one of the things that causes valves to go south and to get funky is the heart enlarges just a little bit because it doesn't have enough minerals, but the valve doesn't enlarge because the valve is not made out of muscle tissue. The valve is made out of cartilage. So as the muscle tissue expands, the valve does not expand with it. And if a certain part of the heart expands just a little bit too much, now the valve is going to be too small to cover the opening of the heart, of the chamber that it's supposed to cover up. And now you're going to have a leaky, funky heart valve, and that's going to cause all kinds of problems. But rarely is this a function of an impatent valve. Usually it's a function of a problem that the heart's just gotten a little bit bigger and the stupid MD missed it, and instead they blamed it on the rheumatic fever, and, the guy needed a new pool, and it was probably the end of the month, and so he signed you up for an unnecessary surgery because that's all that he knew how to do. And, thank God you're alive, and thank God that, the heart is pumping properly now. I mean, these are important things to take care of. But what I would do if I were you is I would give your cardiovascular system all of the nutrients necessary to maintain its structural integrity. And, believe it or not, and you got to get my book because this is going to be a hard sell, there is no such thing as high cholesterol. You do not have high cholesterol. You do not have high cholesterol. There is no relationship between high cholesterol and heart disease. I've done webinars about this. I've done lectures about this. I wrote a whole chapter about it in my book. There is no relationship between high cholesterol and heart disease. You have been played by the pharmaceutical industry pitching you statin drugs. Now, if you were my patient in a state in which I could prescribe statin drugs, I would advise you to stop the statin drug immediately and to flush it down the toilet. Because I'm not licensed in California. I could be. I'm not. I don't hold a medical license to practice in California. Because I can't prescribe statin drugs to you, I can't tell you to not take them. But if it were me, I'd flush them down the toilet, and I would sue the doctor that prescribed it to me, demanding in a court of law that he give me evidence, researched evidence that supports and promotes the use of statin drugs. And very little of it exists. The majority of the researched, published material goes just the other way, that there is, in fact, no relationship between cholesterol and heart disease. So there's nothing to do with statin drugs, in my opinion, except stop taking them, number one. Number two, what causes arteries to clog? Well, you didn't have a problem with a clogged artery. You had a problem with a funky heart valve. So you don't have clogged arteries, but why do people get clogged arteries? Because of inflammation in the arteries. Inflammation causes damage to the artery wall, and the artery wall patches the damage with a cholesterol Band-Aid. So, in order to get on the other side of inflammatory damage to the cardiovascular system, the recommendation is a diet that's high in antioxidants. Because free radicals causing oxidative damage are the main culprit causing inflammation of the arteries. So simply by eliminating the 10 bad foods and adding selenium into your diet, you go a long, long way towards knocking down free radical oxidative damage to the arteries and every other part of your body. So this is a much more prudent way. It's a much more rational way. It's a much more sane way to support and promote the structure and function of your heart than taking cholesterol-lowering statin drugs. The only person whom that benefits is the people that make it, the drug companies. By the way, $25 billion a year in statin drug sales. The only reason your doctor is telling you to take statin drugs is because he or she is not staying current with the literature. It's as simple as that. Now, lightheadedness, I don't know, man. You know, I'm running off at the mouth here, and I apologize, Kevin. Well, under what circumstances did you get lightheaded, and why did you think it was EFAs that did it?
Well, no, I want to be on EFAs because I'm taking Coumadin for the valve. So I've been trying to, because I want to get off the statin drugs. I take the longevity every single day.
All right.
I'm gonna get off the. I could, because there was so much calcification around the valve due to the aortic stenosis, or whatever they call it. Aortic valve stenosis was what they call it, because it was a bicuspid valve. And so I've been kind of staying off the calcium. I took ubiquinol and I took longevity every single day to go ahead and do it. But but my vitamin K count, I guess, gets to be so high, and my INR is always below 2, so they keep on freaking out. So I slowed down some of my longevity, but I want to get an essential fatty acid to replace the statin.
Smart. To replace not the statins, but the Coumadin, right?
Well, I don't know, because I can't seem to get an answer out of my doctors. They're just like, okay, but I'm like, if I'm not eating any
All right,
vegetables.
we're up against a hard break, buddy. I get it now. Stick with me. I'll answer your questions specifically when we come back. Stick around. Kevin from California. So glad you called. 855-347-3696. That's the number to call for more info, or the World Wide Web. Check it out, fireyourmdnow.com. If you can't remember that, just do a Google search for Dr. Glidden. I always pop number 1. Hey, somebody's got to be number 1. All right, we're talking to Kevin in California. Now, Kevin, what you're telling me is you had calcium deposits around the bicuspid valve. Is that correct?
That's correct.
All right, so what causes calcium deposition in anywhere in the body, in the veins or in the valves? It's not calcium. If it was calcium, everybody would have calcium deposition, and nobody has too much calcium in their body, by the way. I've yet to meet a patient, a person, a living, breathing human being who has too much calcium in their body. It is a virtual impossibility. The thing that causes calcium to deposit anywhere in the body is not enough magnesium. You don't have too much calcium, man. You have not enough magnesium. The MDs have gotten it completely backwards. And, honestly, I mean, a little bit of common sense here goes a long way, right? Because MDs have no training, no experience, no respect, and no appreciation with medical nutrition. They're clueless about it. So,
I found that. I went out the hard way.
Well, right. So listening to an MD tell you that you have too much calcium in your body that's foolish, because, I mean, that's just not their wheelhouse. And in a perfectly legal and just society, it would be illegal for them to talk about information that's outside of their domain, but they do it all the time because their arrogance and hubris is legendary. So you don't need less calcium, man. Nobody needs less calcium. You need more magnesium. So the secret sauce for you here is going to be the Cal Toddy. The Cal Toddy. So I would do the Beyond Tangy Tangerine.
Which I do.
And, all right, so, you do 1 bottle per 100 pounds of body weight per month. I would do the Cal Toddy at 1 bottle per 100 pounds of body weight per month. And I would do 1 extra bottle a month, because you've got a magnesium deficiency, and that you need more Cal Toddy than just for maintenance. Essential fatty acids will thin your blood, and they're telling you that your blood is too thick or too thin.
And out of the hospital, barely made it to the minimum of the 2.5 INR level that they want. I mean, they want me to be between 2.5 and 3.5, and I've never met it, and I don't even touch a vegetable. So I've been trying, and I drink 100 ounces of water a day.
Well, by increasing your EFA supplementation, that will bring the INRs into a perfect level, and then your blood will start to get too thin, and then they'll start to reduce the Coumadin appropriately. So when Dr. Wallach sued the Food and Drug Administration, it cost him $1 million, because he literally brought cases in truckloads of research, published research, to the court, which shows that essential fatty acid supplementation keeps the blood at its perfect level of thickness or thinness. So you don't need more or less rat poison, you need more or less essential fatty acids. So by adding EFAs into the bargain, your INR levels will come into the healthy zone, and then your blood will start to get too thin. The INR will be too high or too low. I forget, whichever way it goes. So that's the problem here, or that's what you're up against. So by adding EFAs in mass quantities into the bargain here, you will be able to reduce safely and effectively and appropriately the Coumadin dose. So, how much do you weigh, Kevin?
I'm about 180.
All right, so what I would do if I were you is I would do 12 EFA plus a day. I would do forward breakfast, forward lunch, and forward dinner of EFA plus.
Would that be like the multi EFA, the plant ones, which has the boards and the flaxseed? Would that be much more better for me than the fish oil?
Well, you're a smart man now. No, because of the surgical procedure, the EFA plus would be best for you for the next 6 months. So get the amber-colored EFA plus and do 12 of those a day, and that's labeled EFA plus. The amber one is just EFA. The light straw-colored one, the golden-colored one, is the one that I want you to take. It's called EFA plus. So do 12 of those a day. Do 12 selenium a day, 4, 4, and 4. Do 2 canisters of Beyond Tangy Tangerine a month, and do 2 bottles of Cal Toddy a month, and have the INR checked every 3 weeks. And as the blood gets thinner and thinner and thinner, the MDs will automatically reduce the Coumadin, and that's the safe, easy, and effective way to do it. So glad you called, Kevin. So glad you waited. Ladies and gentlemen, I am Dr. Peter Glidden. Thanks again for your time today. Check me out on the webinar tonight. I will see you all next time.